They're fighting a war here and they're losing. The sheer numbers of people succumbing to the coronavirus is overwhelming every hospital in northern Italy. The staff are working flat out trying to keep these people from deteriorating further. They're trying to stop them from dying. This isn't an intensive care unit, it's an emergency ward. The ICU is full. People have only just arrived here and they're in terrible shape. This is an absolute constant. This killer pandemic is virtually out of control.
This nurse saying the psychological tension has, quote, gone through the roof. We're not even counting the dead anymore, she says. Doctors also making the ultimate sacrifice. One physician, sick with the virus, reportedly didn't want to take an intensive care bed from another patient. It cost him his life.
Footage shot inside Oliopo Hospital in Cremona, Italy on Thursday shows the strain at the front line of the battle. A hospital normally containing 50 beds now housing 120. And that's still not enough. The sound of ventilators feeding oxygen into lungs are heard as patients lie immobile on their beds. Some are able to sit up and signal to nursing staff behind masks. Others lie on their fronts connected to machines, unable to breathe any other way. Italy recorded the largest ever one-day increase in coronavirus deaths on Wednesday, as the total rose by 475 to almost 3,000. It is expected to surpass China's own death count if the situation remains unchanged. With cases still rising, the government is considering further restrictions on the limited amount of outdoor movement currently permitted.
The crisis has not yet peaked in Italy, but in Lombardy, frontline healthcare is already on its knees. The laundry room of this hospital is being used to treat patients. Staff working 18-hour shifts, now treating their own colleagues too. A surgeon in Bergamo updated us on the desperate situation.
A progressively increasing number of nurses and doctors get sick and stay at home. Some of them are hospitalized too, and some of them are in the ICU too.
And what would you say to your colleagues in Europe?
To get prepared to shortage of things they would never think could get short of. For example, oxygen. And personal protection devices are stolen. We have to face these problems that we could never imagine before.
Patients strong enough to travel from Lombardy are being brought by helicopter to other areas of the country. Further south, though, there's already strain too. This doctor shouting to patients in isolation to keep their distance from each other. In just 10 days, this hospital in Rome has been turned into a COVID-19 facility with 180 beds. But if the same crisis levels reach here, it would fill in a day.
I think lockdown would be extended, but I think it would be the safest option. I'm not totally criticizing the UK strategy because it's starting from a very different starting point.
Think what it's like to be a doctor or nurse in the epicenter of the epicenter.
Tutti i sistemi di protezione individuali, dispositivi di protezione individuale, quindi il camice, i calzari, la cuffia, i guanti che sono da cambiare rispetto a quelli che addosso, la mascherina chirurgica, gli occhiali protettivi.
Carla Maestrini and her colleagues have lost track of the hours they're working in the intensive care unit of Cremona Hospital. Coronavirus patients are placed on their fronts while being ventilated, so gravity helps the oxygen get into their bloodstream. That's the normal protocol for a patient with acute pneumonia. But it's not working, and the staff don't know why.
Purtroppo qua da noi non abbiamo ancora visto nessuno risvegliarsi. Noi abbiamo bisogno di togliere il tubo a qualcuno e di vedere che qualcuno sta meglio, perché altrimenti non riusciamo ad andare avanti. Abbiamo bisogno di qualcosa che ci faccia capire che quello che stiamo facendo serve.
But 107 patients have died of coronavirus in this hospital group, out of 845 admitted.
tanti decessi. E questo ci fa morire, perché pensiamo di non riuscire a fare quello che siamo qua per fare, curare la gente e farla star meglio. E in realtà noi la vediamo morire, questo ci fa morire anche noi.
Cremona Hospital has been handling coronavirus patients from the beginning. That's more than 3 weeks now. They've put up a triage tent outside.
Ho capito che noi siamo impotenti davanti a questa situazione. È vero, noi siamo operatori abituati ad avere pazienti gravi in fin di vita, ci crediamo molto, ma questo susseguirsi così repentino di pazienti in pericolo di vita non siamo abituati nemmeno noi. È dura per tutti.
They've turned the pulmonology department into a sub-intensive care unit with another 30 beds. These patients have a better chance.
Sente questo rumore? Come? Il rumore? Sì, cos'è? È l'ossigeno.
Another worry is that while the elderly are more vulnerable, young people are also getting the virus.
40 anni che faccio il medico e non ho mai visto una cosa del genere. Purtroppo c'è una mortalità significativa. Colpisce purtroppo, ahimè, solo le persone anziane. Abbiamo avuto anche un 23enne.
Thanks to the care he received, the 23-year-old survived, a boost for medical staff under acute strain.
Professor Grasselli, what is the situation in Lombardy today?
Well, the situation is critical because we have a huge number of patients currently being treated in the ICU and in our hospitals. I know the situation of the ICUs very well, since I am coordinating the network of COVID-19 ICUs. We now have around 600 patients being treated in the ICU in about 50-55 dedicated ICUs. And we have treated a total of more than 700 patients from the beginning of the epidemic. So if you think that in Lombardy, the total number of ICU beds was about 800, 850, something like that, before the crisis, you can understand that it's an incredible stress for the system.
What is the age range that you are dealing with?
The median age of the patients admitted to the ICU is 65 years. This means that half of the patients are older than 65 and half are younger than 65. In the last 7 days, we are seeing an increase in young people. So, for example, we had a patient, a 20-year-old boy, who was intubated 2 days ago.
What about children?
So, children, we have 3 or 4 neonates, I think, who tested positive and who have not so severe disease. And children, as in China, are basically spared, at least from the symptoms. I'm not sure that they are not infected, but apparently they don't get sick.
Now, given how incredibly pressured you are, do you have to, in a sense, choose between different patients as to who you can treat? In other words, do you, in the end, have to say, look, I'm sorry, if you're over 80, we really can't do anything?
No. Well, we are doing what we do exactly every day in our life as intensivists. So independent from the coronavirus outbreak, when an intensivist is called to evaluate a critical patient, he always has to make a decision about is this patient going to benefit from intensive care? And this is a complex decision that takes into account several factors, not only age, of course, but also, I would say, biological age. So comorbidities, other illnesses, past illnesses, current condition, health status, frailty, and so on. So this is something that we do every day, okay? Clearly, in this situation of incredible mismatch between the resources we have and the number of patients who we should allocate, we have to be more strict in this. I would not call it selection, I would say triage of the patients, but what is driving us always is the consideration that what we have to do is trying to grant to every patient who can benefit from ICU an ICU bed. And clearly not all the patients will benefit from an ICU bed. Because if a patient with, I don't know, very old or with a lot of past illnesses or with a very fragile condition at the beginning gets a bad pneumonia and needs a tube and a mechanical ventilator, his chances of surviving and of returning to an acceptable quality of life are very low.